Welcome to Do Your Health. I'm your host, Rhonda Alfred, and on this episode, we are joined by Dr. Hector Linares, Medical Director of Rehabilitation Services, and Nancy Dupre, Post-Acute Care Director of Rehabilitation Services at Terrebonne General Health System. Today, we're going to be talking about the benefits of occupational therapy and the impact that it has on patients. Welcome to the show, guys.
Thank you.
All right, Nancy, tell us a little bit more about yourself and your role at Terrebonne General.
Okay, I started at Terrebonne General in 1994, so it's almost 28 years. I started out as an occupational therapy, that is my background, and my role is currently the Director of Post-Acute Care Services, and that includes our inpatient rehab unit, it includes our skilled nursing unit, as well as our outpatient clinic.
Okay, and Dr. Linares, tell us a little bit more about yourself.
Yeah, I've been here also for over 30 years, and as we talked about in the previous conversation.
That's right.
And I've been the medical director since I came in year 2000. And so we are glad that we've been able to expand the services with time, and also to survive all this inclement weather that we've been having throughout the years.
Yes,
here we are
yes.
One more time.
COVID and everything else, right?
COVID as well.
Yes,
Yeah.
we are survivors for
Right,
sure.
right.
So tell us, what is occupational therapy, Nancy?
So occupational therapy is a skilled service that actually addresses one person's mental and physical health as it relates to what we call ADLs, or activities of daily living, the things they normally do every day. With occupational therapy, it's very diverse. You could work in various settings, such as a hospital setting. You could work in an outpatient clinic, school systems. You could actually be a home health therapist where you actually go to their patient's home, and even a nursing home. And the population actually, again, it's diverse from babies all the way up to our geriatric population.
Okay, covers a lot.
It does, it really does.
So what is the difference between physical therapy and occupational therapy?
Well, physical therapy, sometimes it overlaps the OT and PT, but as far as inpatient rehab, occupational therapy will focus on a person's, what I said earlier, activities of daily living. What we normally do every day, we get dressed, our grooming skills, did we cook before we had a disability? Those are the activities that they actually focus on. We also focus on upper extremity strengthening and range of motion so that we can perform those activities of daily living, whereas a physical therapist, they focus more on movement, the lower extremities, mobility, how they walk, climbing stairs, getting in and out of a vehicle. So, it's more about lower extremity and physical movement.
Okay, all right, thanks for explaining that. So what type of services do you offer?
Well, it's a wide range. Right now at Terrebonne General, our inpatient rehab unit, that's when the patient actually stays in the hospital. Our average length of stay is about 14 days.
14 days, and that's not only for us, it's countrywide.
Right.
Okay.
So about 14 days, and so the services provided in our inpatient rehab unit includes occupational, physical, speech, even recreational therapy. It includes 24-hour nursing care. We have a social worker, a discharge planner, and we have a physiatrist, which is Dr. Linares. A physiatrist is a physician who specializes in physical rehabilitation. And he's also, as you said earlier, our medical director. And so Dr. Linares will actually oversee all of our patients' plan of care to make sure they're getting the services that they need.
The services that we provide are not related just to the inpatient rehab facility. We do also have outpatient therapies, the same ones that we just mentioned. And the difference is that the patient doesn't stay there. They go back and forth 2-3 times a week, depending on their needs, okay? They can come back and do one therapy or 2 or 3 speech therapy, occupational therapies, physical therapies as well. We do have also a lymphedema clinic that can help that population. We do
Cancer
have
patients, right? That's right.
those primarily, but there are
majority.
majority, but there are other reasons as well. Then we have the NICU, the little babies just born, and sometimes are in need of the occupational therapist services to improve their condition. And last but not least, we start therapies in the acute part of the hospital. As soon as a patient comes to the emergency room with a stroke, we are called, and the services are almost immediately started. And not only for stroke, but since you asked about the stroke specialty,
Yes.
but also other medical problems.
So it's all ages.
Correct.
Yeah,
Okay. So what is the goal of occupational therapy?
Well, the goal of OT is always to try to make the patient as independent as possible. We try to look at, again, that's through their activities of daily living. That might mean modifying their environment. It might mean using adaptive equipment, but it's always to try to get them as independent as possible. A couple of examples is if, let's say we have a stroke patient, and they have very, poor movement or a lot of weakness on one side, the occupational therapist will actually teach them techniques on how they could put on a shirt independently. If it was difficult for that patient to get in and out of the tub, we might use a transfer tub bench to help them get in and out. Again, it's all about trying to make them as independent as possible so that they don't have to depend on others.
Okay. And I know we have a CARF accreditation. Dr. Linares, can you tell us what that is?
Yeah, CARF is an international organization that started about 60 years ago. So it's been growing, all these years, and now includes primarily USA, Canada, and recently added some countries in Europe, some countries in the Middle East, and some countries in South America. So they have a number of programs that they can certify, and a number of, every program has a number of standards that you have to comply with to become certified. Certification occurs normally every 3 years if you are in compliance, and it's a peer review process basically.
Okay.
So as a matter of fact, Nancy and myself, we are CARF surveyors as well.
Yes.
They
Good.
invited us, we accepted the challenge, and it has helped us to maintain up to date all the activities that normally you are graded for.
Right.
So
Best
basically,
practices, that
right.
kind of thing.
So basically, there is about 60,000 programs certified now by CARF around the world. And that will be in about 30,000 different locations, right? So we are certified in 2 different areas: general inpatient rehab and stroke rehab, which is our largest admissions, largest number of admissions are related to stroke patients. So we are very proud. We've been
It's a big deal.
We've been certified in general inpatient rehab since 1997,
Yes,
if
sir.
I recall. And every 3 years we've been recertified. So this past January, if I recall, we were certified the last time, and that's because of the hurricane
Right.
that damaged our hospital.
Right.
Yeah, we were initially scheduled in October and we had to postpone
It just got
it.
delayed
Right.
a little
A
bit.
little
But
bit
we
delayed,
passed
right.
with flying colors.
Oh yeah,
correct?
yeah.
We
As a
did.
matter of
Very
fact,
good.
one of the best surveyors
Well,
and grades.
So
if you
what
will.
exactly does that mean for our patients and our community to have this certification?
For the patient, is a reassurance that we are in compliance with all the standards that, just to give you an example, the Mayo Clinic, or Ochsner Clinic, or Cleveland Clinic rehab facilities are doing. We are doing exactly
So
the
we're
same.
comparable to
We are exactly the same.
bigger hospitals
because
all
the
across the
standards are
country.
the same.
Right.
So
That's-
you have to have the same type of medical facility, the same space, same medical equipment to use, same medical director, meaning
right.
we are, again, comparable to any other bigger center in USA.
Okay.
Just
Did
real
you wanna
quick,
add?
the other thing I wanted to add to that is that this is voluntarily, like we don't have to have a CARF accreditation. So that's the other thing that we add to the community is that we go above and beyond what's required, what our state laws require of us. So we actually go above and beyond. We choose to do that to make sure that we give them more than the usual.
Right. And you mentioned a stroke specialty program. Can you tell us a little bit more about that
Right.
program?
Stroke specialty focus in the general inpatient rehab area, it focus on providing excellence in the patients who has been suffering strokes. So basically, what Nancy said, I think the only thing that I can add is that we do have services of speech and language pathologists, or speech therapists are commonly named, where we provide improvements in their swallowing deficiencies that they may have, the dysarthria, meaning the slurred speech that they may have, and other language problems like aphasia or dysphagia. That is when you don't recall or you cannot bring the words that you want to say. And that's
yeah.
expressive aphasia. It may be also be receptive, is when you don't understand what they're telling you. And unfortunately, we see that a lot of times.
So
Very
they have to
frequent
relearn
problem.
pretty much everything.
Relearn the whole thing, yeah. Not only the functional mobility, the walking ability, but also the way to communicate and the way to provide nutrition for themselves.
Okay.
And that was actually the stroke specialty. We actually earned that in 2009.
Right, right.
And we were the first in the region to actually earn that certification.
And we
yes.
maintain that today.
We sure do.
That's
We
wonderful.
are up to date.
Okay, well, great. Well, if anybody needs stroke care, this is the place to come for sure.
Absolutely.
All right, is there a physician referral that's needed for occupational therapy?
Yes and no. I will say that it'll be ideal that the primary care physician or any physician that is dealing with problem refer the patient, but they can also contact our department directly, right?
Okay.
And if
Okay.
it's necessary to do an eval, I will provide the eval.
Okay, and how can people learn more?
They can learn 2 or 3 different ways. One is in the in our internet site. That would be a good way to
Okay, the
to
website.
access the website to access any medical needs, including the rehabilitation needs. The other one will be through bulletins that we send on a regular basis. And the best, in my opinion, is the word of mouth.
Right.
Satisfy patients, because this is a relatively small community, and so we have a satisfaction rate close to 99% most
Percentile. Sure
most of
do.
the time.
Well, that's wonderful.
Right. And
Can't
so
get any better than that.
No.
Well,
and
good.
so that's very satisfying as well. Yeah.
Great. Well, thank you both so much for your time today and sharing this helpful information.
Thank you, Rhonda.
Thank you.
For more information about occupational therapy at Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.